All right, welcome to episode 4 of Snack Break. I'm just going to invite our guest here and we'll get started shortly. Difficulties with this one, so we'll see. Hopefully this one works out. But some issues with updating Instagram and things like that. I'm sure you guys all experienced the outage earlier this week. So we'll do the best we can here, and hopefully we can get her on shortly. But as we wait for her, I'll just give her a quick little background. She is, oh, here she is. Okay, we might be having the same issue we did before. Let's see. Okay, here we go. Let's see if this works. I got a request. Stephanie, maybe if you request to join me, I can let you in. Let's see if request.
It's working.
Okay. There we go. All right. Despite technical difficulties, here we are. Welcome to episode 4 of Snack Break by Ortho Snacks, where we interview physical therapists, fitness professionals, and health and wellness experts. I'm your host, John Schaefer, and today we have a very special guest. She's a 2008 graduate of Loma Linda's physical therapy program out in California. And she's one of less than 10, I understand, United States Equestrian Federation certified physical therapists. It's a mouthful. And it was her birthday yesterday, so happy belated birthday.
Thank you.
She is Stephanie Seheult. Is that how you say your last name?
Seheult.
Seheult. Okay, that was the last thing I was going to ask you before we went on. Seheult. Got it. But thanks for coming on. I really appreciate you taking time to speak with me and my followers.
Yeah, absolutely.
But yeah, I think I'd definitely like to start the conversation just kind of talking about how you got into working with equestrians and horses. So I think it might be most beneficial to go all the way back to 2008, right when you graduated. I mean, did you have any idea that this was going to be something in the cards later down the line, or kind of what was the start of your journey?
So well, let's go further back.
Okay.
In college, I started as an undecided major, and my mom's a physical therapist, so I didn't want to do physical therapy because my mom did that.
Yeah, that's
and so I was like a personal fitness, business management major, and then decided to do physical therapy because I realized like I was kind of cut out for that. And then when I started PT school, you know, when you're in PT school, there's so many different options that they try and get you exposed to. And I knew I loved orthopedics. I knew I loved sports, obviously from my background in like physical education. And then I actually had an interest in doing women's health, which I did do for about 8 years. So I didn't start with the equestrian stuff until about 4 or 5 years ago. So I had no thought, even when we're in school. I don't know if you ever did this, if you guys have done this in school, but we did some rotations kind of with hippotherapy stuff, and people are like, oh, you should do this, Stephanie. It's perfect. It has horses. And I was like, I don't really want to do that because I'm not really a neuro person. So anyway, yeah. So I had no like idea that I would be doing this. So
yeah, because I mean, honestly, it's not something before I came across your page that I even knew existed. So I don't know. I just thought it was pretty cool, and I wasn't quite sure how you got exposed to it. But how long were you an equestrian, or have you been an equestrian for?
So I've been riding since I was 7, and I just turned 37 yesterday. So I've been riding for 30 years. Yeah.
Oh, wow.
Yeah.
When was your first patient that you treated that was an equestrian?
I'm trying to think if I treated anybody that was an equestrian in the clinic. I think probably 5 years ago is when I started maybe 6 years ago, I started going to competitions and stuff and being like, hey, these people are really out of alignment. They're competing. They're poor horses, you know. So I probably around that time, I started slowly working with equestrians and just kind of seeing what I could help them with.
Gotcha. So I guess I'm curious what the transition was like moving from working full-time in a clinic. I know you mentioned you did women's health for a while, but just kind of transitioning your caseload into working with more equestrians.
So it kind of happened about the same time that I had my youngest child. So I was already kind of not back in the clinic full-time, which made it a lot easier. And I was called back into the clinic kind of around the same time that I started working with equestrians. I'm sure that a lot of people that watch this will know that pelvic floor physical therapy and women's health physical therapy is a really needed form of physical therapy. So that was interesting to me, and which is why I did it. So that's why I got called back, because they were having a really difficult time finding somebody to treat a few of those patients. But at the same time as that is when I started working with equestrians, and I started to really realize a difference that I could make in their riding. And most equestrians, if anybody's watching that's not an equestrian, we really care about what we look like when we're sitting on a horse. And we really care about the welfare of our horses. And so it kind of goes hand in hand in that. A lot of people talk about how the rider affects the horse and all of this stuff. So I was able to kind of tie those two together. But as far as transition wise, it was pretty seamless because I was already transitioned out of the clinic. And not that I was bored with working in the clinic, I wasn't, but I think I just was ready for something different.
Yeah, that makes sense. Just going back to, the need for pelvic health, physical therapy. So many of my classmates seem like they're interested in it. So I think that needs definitely hopefully get fulfilled a little bit more moving forward. You mentioned, and this is something, I don't know if that was funny or interesting or what the best way to describe it, just like the rider impacting the horse and the horse impacting the rider. So is any of your physical therapy actually tailored towards changing the horse's movement, or is it mostly working on the rider and then the horse's movement will correct to follow, if that makes sense?
So yeah, that does make sense. So both. I typically go at it from working on the alignment and stability of a rider first, because the horse, what they do, and we're not just talking trail riding, so we're talking about like more competition stuff. So what you do as a rider is what tells the horse what to do. So if you're weak on your left side, the horse is not going to get what we call a good aid on that side. And then the movement that they're supposed to be doing on that side is not going to be as good of quality as the other side. So most equestrian sports are right versus left. Even if they're jumping, most horses, a rider will knock over the same rail going the same direction every time, or fall off the same side every time. So I usually address it from the rider first. However, there have been a few times when we know it's an issue with the horse and not the rider, and I will help like activate a muscle group or stretch somewhere or give a rider a cue after I've worked on them off the horse to help facilitate the horse's movement.
Yeah, okay. Interesting. Yeah. And just in your description to me, when we talked over the phone earlier, can you describe the Crip Walk again?
Oh, yeah. So those of you that watched any of the Snoop Dogg commentary for the Olympics, so when he was talking about the horse crip walking, that's sorry, it's so funny. That's mainly the type of riders I deal with. So dressage riders, they're the riders that crip walk in the arena. So they're the most like type A, very specific riders out there. So they're the ones that are most inclined to having me work with them as a physio. And then other riders though around, usually if I'm going to a barn to work with dressage riders, usually other riders, maybe jumpers or Western riders, they're kind of like, what is that girl doing with the table at the barn? And
Yep.
yeah, so anyway, but primarily the main riders that I work with are dressage riders
Okay.
who are the Snoop Dogg videos.
I just think it helps. I think it's just think it helps to have that visual for people who haven't been as exposed.
Yeah.
But so I guess I was kind of looking online at some of your different clinics you do. So I saw you were you're in Texas, going to the Bay Area, Washington.
Yeah.
And they're one-day clinics, are they?
So it just depends. Usually when I'm going, so I'm in Southern California. So usually when I go up to Washington, Texas was like a 2.5-day clinic last week. I go to Florida every year during the winter. The further out I go, the longer I stay. So yeah, it'll be 2 or 3 days, and some people choose to do 1 day. Some people choose to do 2 days. Some people are like, sign me up whenever you're here. So it just depends on where. Yeah.
Yeah, because I guess I'm more curious about kind of the structure of these clinics. And so are people signing up a long time in advance, or can you walk into, or a little bit of both?
No. So usually in the horse world, they're very familiar with the term clinic. So what that usually means is that a horse trainer will come into a barn from somewhere else and teach each person. They usually have about 45 minutes to an hour sessions, and teach them for that amount of time, trying to help improve their riding skills. Then I come in and I've used that same model, and I work with riders for 1 hour. So it's very similar to working in a clinic, and they do sign up ahead of time. What happens is that the trainer, or there's a barn and then there's a trainer, and then the trainer has multiple clients. So usually the trainers are the ones that find me, and then they will sign up their whole barn and then plan ahead a few months usually ahead of time before I get there. I do have people, I keep a schedule online because I have people that want to come audit the clinic and listen to what I'm saying, and maybe are interested in having me come to their barn, or have questions and aren't sure if they want to sign up, and I usually let them come watch.
Okay, so it seems like a situation where it's very connection driven. Like you met one person, kind of then got more involved in the community. So that's really cool. Would you say, so I guess what advice would you have for someone who's more interested in getting into more of a niche practice like this? Any advice in terms of like networking or things to do early on?
Yes. So when I first started this, way back, 5 years ago or 6 years ago, whatever I said earlier, I wanted to be sure that what I was going to offer was going to help people. So I ended up giving a lot of free sessions to get their feedback. I also would sit in on training sessions. So I would try and network with other horse trainers and see if I could listen to what they're telling their riders to do, because then most trainers are really focused on what the horse is doing. But if I know what the horse needs to do, I can kind of translate that into what the rider needs to do. So I was trying to formulate what their goals were, since I'm not a trainer. I ride, but I don't know everything as far as that's concerned. And then that's what I would say to do. So, and then also I've told people this, I had a lot of phone calls last year of people that were PTs wanting to get into working with equestrians, which is great. But I said, it's important to offer a lot of free work and spend your time educating yourself on what the goal is with whoever you're working with. So that's really what I did. And then I watch a lot of videos of top trainers in the US. I try and sit in on what training sessions are. The clients that I have that are higher level competitors, I try and sit in on their lessons with their trainers, so that I can just kind of get a better idea of what I need to be tailoring their programs towards. So that's my main thing, is like spend time with the trainers and the coaches so that you can talk to them and really get kind of a feel for what they want to see in their athletes.
Okay, I guess I had never even thought before about going through, your entire documentation, and that you really have to touch on all the same things, whether or not you're documenting it, just in terms of what their goals are, what they're trying to get back to. So is most of your time with these clinics more movement analysis preventative, or is it treating a lot of people who are already injured?
So more movement analysis or movement enhancement. Most of the people that I see are not injured at the time. Most equestrians have major injuries. And so I do have to take that in mind when I'm stretching somebody or giving somebody an exercise to do. So most of it is trying to enhance their body position and their alignment on the horse, and then their muscle balance on right and left.
Okay. Awesome. And then, so I saw that you're also kind of starting to work on a Pilates program online. What's the development of that been like?
So it's way more than I thought it was going to be, but it's been really good. I came up with the idea last year. I've had a lot of clients, like through COVID, they're like, can you please put out videos? And it's really difficult because what I do is very specific to each person. And so I can't just give, and you guys will know, or those of you that are in the clinic, you can't just give the same exercises to the same people because it doesn't get the same result. So I kind of wanted to do something more broad. So yeah, we have a subscription program on my website, and we put out 4 new videos a month, and each subscriber gets those videos they can watch it as many times as they want through the month. And I've been having good results. I've had a couple of riders in clinics that have been pretty diligent with their exercise program with the Pilates exercises, and it's improved their balance and stuff for sure, which is really cool.
Awesome. Do you have any advice for anyone who's thinking about maybe developing an online program in the future?
Yeah, for sure. Hire somebody, because that makes it so much easier. I'm the type of person that tries to do stuff myself, but I found there's a certain point where that works, but especially with technology, like we experienced earlier, I am not, that is not my forte. So I have hired someone. She does my website for me. She's amazing. If any of you like my website, I can give you her information.
Yeah, you gotta leverage those who know what they're doing.
Yeah. So, but she's just been so helpful because she's kind of in the equestrian industry too. So she kind of knew what I was looking for. But then it was super helpful when I went in and was like, this is what I want, and can you make this happen? And then we talked about different options. So that's my main thing. As far as making the videos, I do that myself. I have a video editing program and stuff, and it does take time, but I'm kind of looking towards the future. You have to kind of sometimes front load it with a lot of work and then later reap the benefit. So that's kind of where I'm at right now.
I know I've found just with creating content, if you can kind of set aside one day to do a lot, it makes the next week or two a lot easier, and then you're not trying to catch up. But I guess my last question about what you're doing right now would be what would you say to a student who's maybe interested in working with equestrians in the future? What kinds of things can they do now to prepare themselves and make sure that they're finding these opportunities, because it doesn't seem like it's a subfield of PT that gets a lot of exposure.
No, it's a relatively new field in the US. It's been around for Europe for a long time. And if you look at competition stuff, usually the European teams do better than the US. So I would say it's definitely growing. There's probably more than 10 physios that work with equestrians, but I'm one of only a few that do it full time. Okay. And then that travel everywhere. A lot of people just kind of want to stay in their own area. But I would say my main thing talking to people that are interested in in doing what I do is to really get a good background in orthopedics and sports, and spending time in an ortho clinic working for a while, because even though I'm not doing anything treating pain necessarily always, or any rehab, I have to keep that in the back of my mind when I'm working on different age groups of riders, because I see riders, there's people that are riding horses that are in their 70s and 80s even. And so you have to know how to fix them if something doesn't work out like it needs to. That's my biggest advice. The other advice I would say is, if somebody is interested in working with equestrians, it's super important to be an equestrian yourself. So if somebody doesn't ride and they want to do this, they really need to go out and start riding. The reason I say that is because I'll have a lot of patients with back injuries or post-op back surgery that their doctor tells them, and this is not a slam on doctors at all, it's just they don't ride, so they don't know. They'll say, don't ride, and a lot of people that don't ride think you're just sitting there on the horse and like there's all these compression forces happening on the horse, when in reality it's actually the opposite. If you're riding correctly, you're actually, it's like the best transverse abdominal oblique exercise you'll ever have, because you're using that and it's actually so it's actually doing opposite of what they think. So that's probably the two most important things if someone wanted to get into what I do.
Okay. Yeah, I mean, I really liked what you said about making sure you're watching all kinds of videos of these different movements, because I feel like, especially starting out, there's no way you're going to be able to, see a bunch of patients go through these motions. So you got to find supplementary ways to make sure you're continuing to analyze and learn those movements. That's really cool. All right. And then I've got 5 questions I asked all my guests. Are you up for them?
Yep.
All right. First question is, Stephanie, what is your biggest key to a successful day?
So my biggest key to a successful day is to be able to help one person. Okay. So I feel like if I can help one person and make a difference in one person's ride, then I've succeeded for the day. And then all the rest is just extra and makes it even better.
Yeah, I like that a lot. I think sometimes we set our goals so big that sometimes we forget about some of the smaller goals we reach along the way. So I like that a lot.
Yeah.
The next question I have for you is, what do you wish you would have known 5 years ago, or something that you feel like would have been impactful to hear earlier on?
Really, I think what would have been impactful is don't bite off more than you can chew, because that really, I think as physical therapists, we're a very usually giving type of personality, and it's really important to only do what you are capable of doing at that time. So it's hard, and I told you this when we spoke over the phone. That's been one of my biggest issues owning my own business is, the scheduling and wanting to say yes to everybody. So I would say that's probably something that even now I still need to work on.
Whoops.
Sorry.
You there?
Yep.
Oh, no, I think that was me. I just got a low battery warning, but we should be good. Yeah, no, I definitely agree with that. I feel like, especially when you're working in more of a niche category, like we talked about, you're spending so much time focusing on this one subgroup or population and riders that you've gotten so good at working with them. I don't know if you're just mixing them in kind of here and there, you're not going to be nearly as good as you've gotten. So I think that definitely nothing wrong with focusing on fewer things rather than spreading yourself too thin, like you said. Is there any book or product that you've encountered in the last 3 months that's been influential for you?
So it's not been in the last 3 months, but I was excited to answer this question. So TheraBand changes my life on a daily basis. I use that so much because it's so diverse, and I can I come up with new things for riders all the time with it, and I love that product. I buy it by the roll and take it around with me. Yeah.
What is it? One more time.
TheraBand.
Oh, TheraBand.
Yeah,
Okay.
exercise band. It changes my life on a daily basis.
Okay, I like it.
It's simple, but it's totally true.
Yeah, definitely impactful for us physical therapists. So
Yes.
I like it. The next question: is there any single quote or kind of mantra that you've adopted or lived by?
Yeah, don't ever let anybody tell you you can't do something. So I was told when I was in college, when I was switching my major over from a fitness major to pre-physical therapy, that I wouldn't be able to get my coursework done by the end of my third year of college. Mm-hmm. And it was a counselor that told me that. So I said, okay, well, whatever. So I went back to my dorm room and planned out the whole rest of my schedule. That was just, I told you guys all how old I was, but
secret's out.
Yeah, the secret's out. I went back and it was the beginning of when online classes were starting to happen. So mm-hmm. I was able to I think I took 4 online classes and got into PT school a little bit early. So that was cool. And then, mm-hmm. just I've always kind of lived by that anyway. And just, just see what you can do. Like, you only know what you can do. Nobody else can tell you how or what you can do.
Yeah.
Professionally.
I like that. I mean, I'm sure there's several times along the way you could have stopped, but you kept going, and look at you now. So
yeah.
Good stuff. And then final question for you, Stephanie, what is your favorite snack?
Oh man, that's such a hard question because I love snacks, especially with what I do. I snack all day. I would say a banana with some peanut butter is my favorite snack.
Tried and true. I like it.
Yep, I think that's my favorite snack. I like it every time. So.
Well, thank you so much again for taking time to talk with me today. If people want to follow your journey, get more information, where can they find you?
You can find me at rideadvancedphysio.com, on YouTube at Advanced Physio, on Instagram at Ride Advanced, and on Facebook at, I think it's just Ride Advanced Physio on Facebook. I don't really remember.
Ride Advanced Physio.
Yeah.
Awesome.
Ride Advanced, you see?
Ooh, I like the hat.
Thanks.
Anything else you want to say to any of my followers before we head out?
No, just if anyone has questions, feel free to reach out. I have a huge heart for helping students. I really enjoy teaching. So if anyone's interested in anything I do, reach out and I'm happy to answer questions, and that's all.
All right. Very cool. Well, keep up the awesome work, Stephanie. You're doing great things.
Thank you so much.
Yep. Have an awesome rest of your week.
Bye. Thank you.
Yep. Thanks for tuning in, everyone.